To Psyfeld, where today's discussion at Robert Wood Johnson is going to focus on the Seinfeld episode, The Baby Shower. So just a quick piece of housekeeping. I am expecting a call, so unfortunately, it may disrupt our session this morning, but we'll try to get in as much as we can in our discussion. Where would you like to start with regard to any character or anything you saw that you think is worth discussing this morning?
So something interesting from the episode that I remember was when Leslie was talking about how she had a planned C-section because her doctor told her that if she gave birth, she was likely to become psychotic. I just thought that line was interesting, and I wanted to look up more about, postpartum psychosis. So maybe some of the reasons why Leslie was being told that was because maybe she has a history of bipolar disorder in her family. Maybe she herself has bipolar disorder. I mean, maybe her mania could be like a sign of the performances that she was giving. Maybe that could be, kind of a hint for the audience there. And yeah, so I just wanted to bring up the link between bipolar disorder and the increased chance of postpartum psychosis.
Yep, I think that's where you go with this. So you have this character Leslie, who actually does get some, for lack of a better word, psychoeducation with regard to her postpartum period. There appear to be a couple of different case formulations to consider when a woman experiences a breach in reality testing following delivery. One is a condition that would fit the definition of brief psychotic disorder. So there is a marked stressor, and then incident to that marked stressor, of course, in this case, it would be childbirth. The individual incorporates a delusion and could demonstrate other aspects of psychosis as well, but it's usually a delusion. That period will last only up to 30 days. So it really is consistent with a diagnosis of brief psychotic disorder. Brief psychotic disorder does not evolve past 1 month. On the other hand, there is another, I think, differential in which the trauma of childbirth actually uncovers an occult bipolar illness. And that may be a pre-existing condition or someone who is simply predisposed and who has not yet experienced a mood episode that is a change from previous functioning. And in Leslie's case, it sounds like her physician provided her feedback to with regard to the latter. And there seems to be some evidence that either Leslie is at incredibly high risk or perhaps even diagnosed with bipolar, providing that the feedback to the patient, the psychoeducation to the patient that she, quote unquote, may become psychotic. So less likely brief psychotic disorder, in as much as you wouldn't necessarily tell that to a woman who is ready to deliver. But then again, if you understood that there was increased risk or predisposition, yes, that psychoeducation would be meaningful. To ignore that would be negligent. On the other hand, let's establish, and this is just for teaching purposes, that Leslie has a past psychiatric history significant for bipolar. Why isn't she on any medications then? Any idea as to why Larry David would not have written mood stabilizers into the script?
So lithium can cause some birth defects?
Lithium can cause birth defects. That's exactly right. Anybody care to discuss what birth defects lithium may induce?
Epstein's anomaly?
Epstein's anomaly, yep, it's an atrial defect. It's usually right-sided, and it can be induced, that is, it is a teratogen, especially during the weeks of fetal development, specifically of the fetal heart, right? It's in the first 8 weeks. So individuals who are at high risk can certainly make a choice not to be sustained or maintained on lithium, But after week 10, when the fetal heart is formed, they may be placed back on it with, again, some discussion of the risks and benefits of doing it at that time. And in Leslie's case, perhaps she made an informed decision not to restart the lithium, which of course would put her at higher risk. Again, a risk postpartum. This may come up on board exams for clerks in terms of incidence. It's low, it's about 1%. But again, it's a risk-benefit discussion that obstetricians must have with their pregnant patients. Any other medications that might be in play here other than lithium? Anti-epileptic drugs can also be teratogenic, although their teratogenicity is not localized to the heart or the developing heart, but instead the spinal cord. The point prevalence here is actually higher than that of Epstein's anomaly, maybe as high as 10%, 1 in 10 pregnancies that are maintained on medications like sodium valproate, that's Depakote, for bipolar or other illnesses for which it's indicated, including seizure disorder during pregnancy. So she may have been managed and maintained on sodium valproate, that's valproic acid, up to conception, up to discovering that she was pregnant. After a discussion of the risks and benefits of being maintained on that medication through her pregnancy, Leslie may have made an informed decision not to continue that valproic acid. And that might have actually resulted in her saying what she said at that baby shower. Right, so those are the two that come up. Of course, there's another class of medications that are FDA approved for the treatment of bipolar affective disorder, and that they are the antipsychotics, most of which are the second generation or the atypical antipsychotics. And although they're not teratogenic, certainly there's risks and benefits of being maintained on an atypical antipsychotic throughout pregnancy as well. And it seems reasonable to assume that upon hearing those risks and those benefits, this informed patient decided that she did not want to continue the antipsychotic if, in fact, that's the medication she was maintained on. All right. So again, brief review of postpartum psychosis and certainly treatments of bipolar if the postpartum psychosis is due to that bipolar disorder. Again, it may be due to a brief psychotic disorder that is in someone with no predisposition, the onset of psychosis incident to childbirth that lasts no more than 30 days. That's brief psychotic disorder. The other thing I just want to mention before we may shift characters is the relative terms of postpartum blues and postpartum depression, now called peripartum depression. In 2013, the American Psychiatric Association recognized that up to 50% of depressive symptoms actually begin during pregnancy. So the term postpartum has been replaced in the DSM-5 with peripartum depression. This is major depressive disorder, meeting those 5 criteria that occur incident to childbirth, and in 50% of the cases even are observed prior to delivery. On the other hand, if not clinically significant, if time limited, and if less than those 5 symptoms, likely the peripartum blues, which is largely an adjustment reaction. However, biopsychosocial factors always impact behavior. Biopsychosocial factors are also the cause of the postpartum blues, but the primary focus, the primary impetus is the adjustment to being a new mom and everything that brings. All right, any other thoughts on Leslie? I'm going to try to get a slide together for everybody, quick table that I'll post on Instagram outlining postpartum blues, peripartum depression, postpartum psychosis for brief reference. Any other characters from Seinfeld's The Baby Shower you'd like to discuss this morning? That's it. Only.
Hi. Hi, good morning. Can you hear me fine?
Good morning. You're fine.
Great. I thought it was interesting when it was a scene of George and he was planning to sort of tell off Leslie, and he was very motivated to do so, but then when it came time to it, he sort of simmered down and went into his old ways, it seemed like. And then even when he was interrupted by the scene of the other lady telling off Jerry, he saw exactly what he wanted to do. And despite that, this didn't like put him back on track. He still stayed with sort of what he was talking about before. And so I wanted to know, is this like a personality trait? Is this a habit, or is this like some kind of mental block that he had? So I was wondering what your thoughts are on that.
Yeah, so I think for George, I think the first step, and you'll see this in several PowerPoints that I've put together pertaining to case formulation, that behaviors are normal until they're not. So I think the clinician's first response or initial response to what is observed here at the baby shower with regard to George Costanza is that this is normal behavior. This is someone who wanted to do something, decided then not to do it, saw something happen in front of him that was certainly similar to, if not exactly, the behavior that he wanted to actually manifest, but still then chose to continue his current course and do nothing. Okay, so to not pathologize behavior, perhaps then this is just normal behavior. On the other hand, if we see this as recurrent and clinically significant, I think a physician has to weigh in. And this is where a psychiatrist or perhaps even a psychologist can case formulate what's going on, to the extent that a person like George Costanza would present to clinical practice with a chief complaint. For those of you who know the situational comedy, you do know that George often has ideas that he backs out of. And on several occasions, after backing out, he will see his best friend, his high school friend, do the thing that he would like to have done. And it will result in conflict for him. So it is reasonable to assume, or at least for purposes of our discussion this morning and wanting to teach what might be going on here, we should assume that he does present to clinical practice. He does actually come in with a chief complaint. The complaint is not going to be, hey, I was at a baby shower and I just, quote unquote, chickened out in doing something that I wanted to do. I wanted to tell a certain person off, decided not to. Then I saw exactly the way I should be, and of all people, my best friend, but I still couldn't get myself to do it. He's probably going to come in with a chief complaint of anxiety or dysphoria. And it's the clinician's job to really shrink down what is the root cause of this HPI. And when George gives us the history of present illness and basically discloses then the plot of the baby shower, we could begin to discuss the root cause of what is really going on, not only in this particular scene, in this particular episode, but with regard to the pervasiveness of this, because if you've watched the 9 seasons of Seinfeld, you know that this type of behavior in George Costanza is quite pervasive, and it is clinically significant. It does impair his functioning. So with all that stated, certainly we could look at personality traits as being indicative here, because it is so pervasive and it's so stable over time. I mean, it starts at season 1 and then ends at season 9. And if Larry David had chosen not to have that series finale when he did, and brought this out 20 years, 25 or 30 years, George Costanza's character likely would not have changed that much over time, right? So this is something that's incredibly stable. And if that's the case, we're looking at a personality trait, and therefore we're looking at a personality disorder. And here, there's probably some evidence of avoidance, right? Avoidance personality disorder, or avoidant personality disorder, where avoidance is the defense mechanism. At times of conflict, okay, and conflict here equals anxiety, right? Freud's initial description of conflict was anxiety, the individual will put into effect internal mechanisms, subconscious mechanisms called defense mechanisms to alleviate anxiety. One such example is avoidance, a defense mechanism. In this case, there is increased anxiety with regard to what George Costanza is about to do. And to tolerate that anxiety, to reduce that anxiety, he just simply avoids the thought of confronting this person who he believes has wronged him. And despite the fact that he then sees the way the behavior may play out, he continues to go down that path of avoidance and ends up leaving the party with Leslie, carrying all her things out for her. And there is something, I think, to say about the role Jerry plays in this, and that is in medical texts, in the evidence-based literature, avoidance personality disorder happens to be one of 4 personality disorders that can improve over time or has shown a consistency in improving over time. The other 3, by the way, are dependent personality disorder, antisocial personality, and with regard to the metric of interpersonal relationships, even borderline personality disorder. So those are the 4 that do appear to have some improvement over time. One of the reasons why avoidant personality disorder is proposed to improve over time is because of the core feature of this with regard to the thought that it is better never to have loved at all than to have loved and lost. So if I don't put myself out there, I can't get hurt. And that avoidance behavior, not putting yourself out there, then is reinforced, right? Because you don't get hurt. And the absence of being hurt or denied or turned down or rejected forms a negative reinforcement paradigm, resulting in strengthening of the avoidance behavior. That's negative reinforcement. Over time, however, decades, the individual will need to put themselves out there in certain situations, and they may see that this automatic thought of rejection may not actually be true. So they actually challenge their own thoughts in the CBT type of paradigm just by naturally going out there and doing the things that they have to do, like maintaining a job. So over time, that type of behavior may actually result in a weakening of avoidance as a defense mechanism because it's proven to be false over time, resulting in itself the observation that this condition of the avoidant personality disorder tends to decrease itself as the patient gets older. Unfortunately for George Costanza, that it does not seem to be the case. Right? But it's interesting that Jerry actually models the very behavior that individuals struggling with this condition also are exposed to that result in the avoidant personality improving over time. That's the role Jerry plays here. Anything else about George? Any other character you want to discuss this morning?
Hello?
We can hear you.
Okay. So I thought Elaine's actions during the episode, well, the premise of they established the premise of the episode, but her relationship with Leslie sounded pretty one-sided from the way she described it. Leslie doesn't really teach Elaine or treat Elaine with much importance or regard, but Elaine said that for some reason she feels the need to please her. It almost sounds like kind of like she kind of acknowledges it, but it sounds like an abusive relationship or like some kind of Stockholm syndrome type thing where even though she's getting no sympathy and no reason for affection from Leslie, she is basically like her servant in this episode.
And if Elaine again presented to clinical practice a day after this event and said, I just had this happen to me just yesterday, and talks to a therapist or talks to a clinician a psychiatrist, about how it's bothering her, the way her friend Leslie treated her, the psychiatrist would definitely probe, that's probe with a B, probe that, or whether this behavior on Elaine's part was recurrent and clinically significant. And to the extent that she might be seeking help, I think clinical significance is implied. At that point, I think we would need to talk to Elaine about what motivated her to really continue this relationship and what role she plays with regard to this quote unquote friendship she has with Leslie. One of the things we did note, we have noted before, is that this probably is embedded in object relations theory, and the idea that one's adult relationships are significantly influenced by the primordial relationships in early childhood, and that's usually, of course, with the parents. And that we have met Elaine's father, I believe, in 2 or 3 episodes, and in every occasion, he is painted as a very emotionally distant, very austere and intimidating man. He's very wealthy. Elaine comes from wealth, and she's privileged. And despite that, there has been this emotional distance that has definitely affected her ability to build meaningful, intimate relationships as an adult. And this is absolutely another example. Now, of course, Elaine's character is really defined through her intimate relationships with men, episode after episode. I mean, her boyfriends can actually have their own spinoff in another universe and be a very successful situational comedy. That's Elaine's character, and that was intended by Larry David and the writers. Having said that, her relationship with women as an adult is not much better. It is also clinically significant on several occasions during several episodes. So even though we see Elaine's father in 2 or 3 episodes and understand through certainly object relations theory and attachment theory, why her intimate relationships with males and men are maladaptive, we don't know much about her mom. And I think in therapy, that's where this would go. So even though she comes in frustrated, disheartened, angry about how Leslie treated her and how Leslie treated her so poorly in this one-sided relationship over the years, ultimately, we're probably going to get to the root of this and probably bring in a character that I don't even think has ever been addressed in any of the 9 seasons of this situational comedy. There's one episode where we find out that Elaine has a sister. It's unscripted. There are about no more than 3 episodes, I believe, in which her father appears, but we never hear a single reference made to her mom. But in this conversation, this is where that character would fit in. We have about 5 minutes left. Anything anybody else wants to discuss pertaining to anything that they observed in the current episode, the baby shower? All right, then we'll leave it here. I will see everybody about 9:30 in the hospital, and see everybody back on Periscope at 12:30 when we have our film analysis later today. Thank you.
Thank you.
Thank you.
Thank you.